Hello, Dr. Benjamin Domb here, presenting on the effect of preoperative opioid consumption on the outcomes of hip arthroscopy for femoroacetabular impingement and labral tears. It is no secret that the opioid epidemic in America has been a huge problem. And if we look backward, the pendulum clearly swung. In the 90s, the medical community was criticized quite publicly in the media for not adequately treating pain. And this led to more opioid prescriptions. Unfortunately, the pendulum clearly has swung too far, causing an epidemic of opioid abuse and deaths associated with it. In this study, we evaluated pre-surgical opioid-based pain control, which has been recognized as an adverse prognostic factor in multiple orthopedic surgeries. Specifically with regard to hip surgery, this has been studied in arthroplasty, and indeed it has been studied in hip arthroscopy in this article here as a cautionary tale. The purpose in this particular study was to evaluate the short-term outcomes and the recovery curve of patients undergoing hip arthroscopy for femoroacetabular impingement and labral tears who reported preoperative opioid use. And we included patients who reported daily opioid-based pain management within 1 year of surgery. They completed pre- and post-operative patient-reported outcomes at 3 months, 1 year, and 2-year follow-up. And those patients were propensity matched in a 1-to-1 ratio to a benchmark control group that did not have preoperative opioid use. We had 249 hips with preoperative opioid usage that were identified and had 95% follow-up on those hips. We then were able to match 236 of those to the benchmark control group. The 236 patients in the preoperative opioid use were matched to 236 control cases that did not have preoperative opioid use. And the preoperative opioid group demonstrated significant improvements across all patient-reported outcomes at the 2-year follow-up. There were no differences in demographics between the groups, so they were well matched. The preoperative opioid patients started with lower preoperative scores almost across the board in their PROs. And they experienced a prolonged recovery, which was indicated by lower scores at 3-month follow-up and at 1 year postoperatively. But by 2-year follow-up, they had achieved similar postoperative scores. So we can see that in graphical format here. And if we focus our attention on the modified Harris-Hip score, for example, on the upper left, we can see that they started lower at 3 months and 1 year. The preoperative opioid group was lower, but then by 2 years, they had caught up and were basically equivalent. And we see a similar pattern in non-arthritic hip score, sport-specific subscale, and visual analog score. We do see a different pattern, however, in satisfaction, where the preoperative opioid group had lower patient satisfaction at 2-year follow-up than the control group. So in conclusion, hip arthroscopy for treatment of FAI and labral tears in patients using daily opioid-based pain control resulted in significant short-term improvements. Compared to a benchmark control group, these patients experienced a prolonged recovery process before ultimately achieving comparable functional outcomes at the 2-year follow-up. Despite these improvements, preoperative opioid patients did report lower patient satisfaction at 2-year follow-up. Thank you very much.